and Bob for a wonderful presentation that really helped us to think as a roundtable about the right role and place of communications. And I think you debunked some things that we might have started off with, but are leading us in grounding ourselves in science of health communications. So this time is to really have some time with Dr. Hornik to be able to, for the audience to ask questions. So the audience that is here in person, as well as the audience that's on the webinar, right, Drew? We will be able to take questions from the webinar. So please, if you're attending in that way, please submit questions that you might have. So I see our first question from Dr. Kindig.
Dave Kindig from the University of Wisconsin. Is this my phone? Yeah, okay, and thanks again very much. That was really very thoughtful and helpful, and reminding us that a lot of our goals have been about outcomes and not about behaviors, is a real challenge that we really need to take to heart. So you said you wouldn't talk about audience much, and I know we're going to hear about that later, but let me just ask you, let's assume for a moment, out of all those goals, that getting the waste out of healthcare and redirecting it to other upstream investments is the behavior that we were interested in, just for the moment. So what kind of, should we go to a popular audience through some of the things that you've discussed, or should that be directed at a policy elite audience? And if so, how would the strategies differ, what you've presented to us? I hope that's clear.
It is, and of course it's not a question I can answer easily, but it wasn't meant to be, I think. So it really depends on the empirical evidence about, well, first of all, you need to tell me what the behavior is. I still don't, getting the waste out of healthcare is again an outcome, but who's supposed to do something? Is it a policy? I mean, you need to tell me at some level, I need to have the Congress do this. Or I need to have people talk to their doctors and say, tell me what money you're wasting here. That is, you need to tell me what the behavior is, and then I can really begin to talk about the audience. You clearly are still at the level of, it seems to me, outcome, what you want to happen, but I'm not the expert in what behaviors will produce that outcome. What I can tell you about is what communication and other influences might affect that outcome, that behavior, once you tell me what it is. But it's...
Okay, so I take that, and I appreciate your pushing us further in the behavior mode that we want to be. But just let me follow up. Let's assume that the behavior is for policymakers, either, say, elected officials or hospital administrators or health insurance executives or governors. Is there a communication approach that's more effective with policy elites than with the general public? Or do you have to get through the general public to actually influence those decision makers' behaviors?
Yeah, obviously, people have taken various approaches. So there's work, what's called, sometimes called astroturf work. So what happened during the original healthcare reform, not the Obama one, but the Clinton one? What did the drug companies do? They created these ads. What was the name of the characters? Harry and Louise. They didn't play them any place but Washington, right? They didn't play very much around the country, a little bit, but basically they were clearly meant to tell policymakers that your people out there are seeing these and they're going to care about X. So the assumption was that policymakers cared about something. That is, that their constituencies would be unhappy with them if they gave them a healthcare system that made them lose benefits. So obviously the drug companies had a notion about what was going to influence policymakers' decision. So they had a model. I don't know if it was right or not, but it did work in the end. Whether Harry and Louise, you have a degree of freedom of one here, obviously, and so it's really hard to be sure what was the influence. But clearly the argument was that Harry and Louise ads, which were not meant to influence the actual general population, but meant to influence what's called the third person effect in communication science. That is the idea that I act because I think not because it affects me, because I think it'll affect you, and that I have to act in response to that. So, that's a particular model of behavior change that somebody else would argue. Sonny was saying, I could find a bipartisan place. That is a particular set of messages that would work wouldn't raise values, the partisan hackles, but will actually work for both sides. And each group could then act because it wasn't threatened by it. It's very particular. I hate to say it, but just like quitting with help and quitting sound like the same behavior, but they're not. This is also true here. I know it's painful. And it's why we in some ways have been historically much better at things like tobacco-related behaviors, individual behaviors, than we've been, for example, at environmental change. Because no environmental behavior matters. It's a category of behaviors that matters for the environment, and we don't know how to get people to do that. Because the problem is that every single behavior they engage in, whether they buy a Prius or they recycle their garbage, are really different behaviors with different influences. So the notion that as an environmentalist, you say, well, just get them to have pro-environmental values. That assumes that's what matters with regard to those decisions, but it may not. Just like SES is a determinant of health, may matter for some people, but maybe not for others. And you've got to do the research to figure it out.
Well, good morning, and thank you. And on the Harry and Louise ad, I am Tricia Brooks with Novo Nordisk. Always love to be the drug company in the room, right? I want to thank you very much for that. I think that the perspective of the audience versus the perspective of the sponsor is so key. And when we think about health promotion, we're all focused on health promotion. We often come at that from that patriarchal sort of health education equals health promotion. And I think what I heard from you is really health promotion equals health education times context. And if we're not multiplying the education by any of the context of where that individual or that policymaker learns or receives that information, then all the education in the world would equal to zero. Right, 0 times that education would be 0. So I think for me it was so valuable to hear you say it from the communication lens. And I think when we think about that ongoing advocacy voice, even more than media advocacy, is sort of that underlying advocacy voice that keeps the face of the purpose for what we're doing and the urgency for the need to act. And I guess I would sort of turn to you for advice on maintaining even, I think the media can be a tool or a tactic, but if you don't have that underlying face and urgency, you lose that continued kitchen sink effort. And I was wondering if you had any input on how to maintain that in the process of all the noise. A big statement with a question, right?
No, it's not. I respect the question. I think it's exactly the right one, and I wish I could tell you how to do it. I mean, we can go back and look at those programs that did it. Mm-hmm. So what did the smoking movement do? Because it became a movement, clearly, with lots of contributors, and trying to trace that history. The drunk driving movement, Mothers Against Drunk Driving, and how it organized itself and maintained media attention over time is, again, a very important case, I think, for a specific outcome, which was lowering the risk of drunk driving. Similarly, what really gay men did to assure allocation of resources towards HIV was crucial, the way they organized themselves and got public attention. If you look at the way the global program on AIDS continually focused people's attention, they said it's everybody's problem, everybody's at risk, even though epidemiologically it wasn't actually true. Except there was tremendous differentiated risk, but somehow they got public media to say and the public mind to say everybody was at risk, so therefore we ought to invest in it to protect our daughters and our sons, even though their risk was quite a bit different depending on what their own behaviors were. In any case, it seems to me my answer is not specific, but let's look at those historical cases that have been successful and what did they do. And all of them, it seems to me, have political movements at their core.
Because I think if you do the simplicity of, tobacco cessation or obesity, healthy living, or vaccines-related conditions, or even mental illness, so there's a handful of things that I think are the core of what we can get to many of the other determinants. And I just, just maintaining urgency on those things seems to be daunting, correct?
I'm not sure I picked up the argument you're making.
If you take like 5 key things that we think could impact the health and wellness, and it seems to be you get these recurring themes of obesity management, mental health, using vaccines, HIV prevention, and tobacco cessation seem to be the ones that rise. And even those we're moving on a handful, but maintaining urgency for the larger issues seem.
Yeah, I mean, the ALS challenge data, which up and immediately back down, is different than some of those others, but not that different.
Right.
That is, if there isn't media attention constantly, I think they go away. I think you're right.
Thanks.
So I got this is Pamela Russo from the
I'm sorry.
Pamela Russo from the Robert Wood Johnson Foundation. So I guess your message, behaviors, specific behaviors. But in behavior change, there's a starting notion that you have to have some awareness or insight, whatever the terminology is for that. And so my argument is that population health as a concept, or multiple determinants of health, interdependency, that awareness, that framing of the discussion has grown over the past 10 to 15 years in this country. And because I remember when we started the Health and Societies program, I Googled population health, and there was less than a page. You Google it now, it's thousands of pages, although it's also now population medicine under the rubric of population health. So I would see those unnatural causes and other things not as one-offs, but as you described, this sort of multi-pronged. You are, or call it county health rankings, you're reframing people's notion of what affects health. And it doesn't take you to a necessary behavior, but isn't that reframing sort of an important part of?
I don't know. You need to argue it is. I mean, you need to argue that people who have this perspective do something different, and I think probably policymakers being the most important group here, that somehow they act differently than if they didn't have that perspective. And I have no reason to think it's not true. It may well be true, and that's clearly the underlying argument here, but you need to make it. You need to make the claim that not only is it true that population health, the multiple causes of health, but that also it affects some behaviors that seem to matter. And I'm not saying it doesn't. I mean, I just want you to make the argument that not be satisfied with 100% belief that zip code matters.
So the question is, what happens when your tagline, like population health, gets co-opted by another group like population medicine? How do you respond?
Just ask Homer Simpson. I mean, that's a version of that in which, in some sense, they're making use of it for a completely different purpose, which is to get people to pay attention to them. Maybe the ALS got some extra money out of the fact that Homer Simpson got viewed 22 million times, but it's not quite the same issue, but it's related. That is almost, and that is I'll make a more general statement here. The risk of using shaping media strategies. You say, oh, well, most people are really exposed not to what we put out, but what's out there already, so we want to shape what's there. You don't get to control that all that much. You create a TV ad, you can create exactly what's said in that TV ad. When somebody else picks up your idea, and that creates tremendous exposure, you don't control it anymore. Because the local news program wants to make it controversial and sexy somehow, and local. And so it's really hard to get them to shape it just the way, with the subtlety with which you want. It's a hard task. I wish I could say I have. Here's the strategy.
Let me just, before we take the next question in the audience, do we have anything from our web audience? Okay, George.
Yeah, George Isham, Senior Advisor at Health Partners in Minneapolis and also co-chair of the Roundtable. So I think as I listen to your talk, and I'm a doctor, so I'm just absolutely know nothing about communication. As I listen to your talk, I'm struck by the distinction between the all but the kitchen sink approach versus the specificity around communications to change specific behaviors. And I served for a period of time on the U.S. Task Force the Task Force for Community Preventive Services at the CDC, which was about preventive services, evidence-based reviews of those things that worked for preventive services in populations, as distinct from the U.S. Task Force, which was preventive services by individual physicians in offices. And in that community setting, I was struck by the fact that the multi-component interventions were the most effective for the broad task of changing preventive services in populations. Over and over again, the reviews would reveal that a multi-component sort of strategy was the best strategy. So I'm wondering, is that equivalent to your all but the kitchen sink approach for what is a higher level sort of objective of changing social behavior in a group, a collective set of social behaviors, achieving a larger objective? Is there an analogy there? And then if there is, it seemed to me that it was pretty important for the task force to really define a clear logic diagram, evaluate the strength of multiple points of intervention, and then for the multi-component sort of approach, really put together a set of multi-component interventions that were based upon some rationale, as opposed to what's implied by the all but the kitchen sink sort of approach, which, you know, seems to me, and I'm not sure that's what you intended at all. But I wonder, one, am I drawing too much out of what you said? Is there an analogy there in your mind? And then what might that imply for how we might go about achieving some of the, you know, grand scale outcomes that have multiple behaviors, and what might that imply for some of the work we might have ahead of us? I hope that question makes sense.
It does, and it has a sequence of questions in it, some of which my answers will be just the opposite of my answers to other parts of it. But yes, there's an analogy between multi-component community programs and the all but kitchen sink. But let me deal a little bit with, I think, what some of the implications were there. So it's one thing for a single community program to do multiple things under its control. If it has the resources to keep that going over time, then that's great. What I'm struck about with the Mothers Against Drunk Driving, with the tobacco movement, it wasn't a single entity operating. It was various entities picking up a theme and doing what they did best, rather than depending on a single management entity doing it all. So if you can do that and maintain it and get to everybody and lots of sources over time, it is analogous. But I worry a little bit about saying, well, that's what we have to do, because it works as well as these kitchen sink programs, which are much more complicated to compartmentalize, I think. The other thing I want to make, and this is an anti-researcher comment, coming from a researcher obviously, but an anti-researcher comment, is our temptation to try to say, what was the component that mattered? Because all of them cost money after all. This one cost $1 per person, this one cost 50 cents. Which one is the one that matters? Yeah. And I think you can't do it with an all but the kitchen sink program. I think there's an interaction among those components in terms of getting public attention, for example. You know, one might be more influential with regard to changing a particular behavior, but in terms of getting public attention, which leads to policy change, maybe it's the other one that mattered, or maybe it's the fact that they were both there. So I worry a lot about our logical desire to cost out and charge and declare the effectiveness of this. It's not like those pills or vaccines. It has a different shape to it, I think, than that. So while the logic you laid out is perfectly right, I worry about it, to be honest. And so all but the kitchen sink is a little different, I think, in the end.
So, you know, very astute and helpful response, actually. I really appreciate that. But it would seem that if you shift to the movement model, then that's sort of shift to a movement rather than a single actor control kind of model, which is implied by the multi-component thing. Yeah. Then that movement sort of model in and of itself, because there are multiple disconnected actors, sort of figures out the best pathway forward by trial and error,
Yeah.
and may end up with a similar sort of result.
Maybe.
Maybe. And thank you so much for that.
Yeah.
So we have time for one quick question and response, and then we need to move on to our next.
It's really more, I think, a comment that draws from what Pamela had to say and what George had to say. I'm Martha Gold from City College. That was a wonderful presentation, and it also was a sort of demoralizing presentation.
That's why I added that third section, so
Well,
I saw that.
But I'd like to remain optimistic. And I guess getting back to the themes here, it seems to me that movements get built. So we think about climate change, right? We think about a march that goes on in New York City and across the country. And the issue becomes, can you get people to think in terms of the problem through communication strategy, and then to bubble up behavioral changes so that you're exchanging your light bulb for a more energy efficient one? Should we in this setting be thinking strategically about a communication strategy that really kind of gets the news out, rather than thinking about, boring down on particular behavioral strategies and leaving that to other actors, as I think George was implying? So it's sort of rhetorical, but if you'd like to answer it, that would be great.
I mean, it clearly is an alternative approach. As long as you can make a case that you see a path from that set of understandings, that change of norm, change of belief, change of frame, if you want, to actions that seem valuable, rather than just getting people to believe the right thing for its own sake. I guess I worry about that. If you don't have a path to seeing it changing those bulbs, those light bulbs.
Well, I just want to thank Dr. Hornik again for giving us a very, I think, encouraging, because it's putting us on the right path, even if it's debunking and some of the things that we thought or believed, but that's what some of today is about. We all are academics and professionals in our own right, and not communicators like you are, and we so appreciate your taking the time to be with us today and to leave us a lot of wisdom and a lot of things to consider and ponder in the days ahead. So thank you.
Thanks very much.